Los Angeles County took a huge leap Tuesday, March 2, in hopes to reopen its economy and further loosen its public health limits, watching its coronavirus case rates fall to just shy of the threshold for the state's less restrictive red tier. According to the state's latest update, the county's adjusted case rate stood at 7.2 cases per day per 100,000, right on the cusp being able to move out of the most restrictive purple public health tier, a status it has never attained since the state installed its tiered system. Purple to red matters because under the state's blueprint for a safer economy, while the risk of virus spread remains substantial, many indoor business activities long closed would be eligible to reopen, with capacity limits, if the county agrees, when the rate falls between 4 and 7 cases per day per 100,000 people and stays there for 3 weeks. On-site learning for school grades 7 through 12 would be able to resume. Restaurants, movie theaters, long closed indoors under the most restrictive purple tier, could open indoors with capacity limits. Shopping malls could see their capacity limits raised. The county so far appears to be meeting other threshold requirements, including its 3.5% positivity rate. Being on the cusp of a new tier is a reflection of adherence to public health directives, and a vaccination effort that, though plagued by distribution shortages, is gradually getting shots in the arms of county residents, officials say. There's also a fair amount of apparent natural immunity because so many have already been infected. County officials have estimated that beyond the confirmed numbers, about 1 in every 3 county residents have actually had the virus. 7 California regions, including San Francisco, crossed into the red tier on Tuesday, and several others were poised to do the same next week. Neighboring Orange County has already met the threshold metrics for the red tier but must then hold those rates for another 2 weeks. We do anticipate a majority of Californians in the new few weeks to be residing in counties that have moved out of the most restrictive purple tier, Newsom said Monday, stressing that the state was not waiting for the tiers to kick in before moving forward on plans to open elementary schools for in-person teaching. While the state's trajectory is on a positive course, the potential for loosening restrictions comes as public health officials are waving some caution flags. With some states, such as Texas, removing public health mandates, top health officials have voiced alarm about moving too quickly, a mistake repeated throughout the pandemic. CDC Director Dr. Rochelle Walensky warned on Monday that we stand to completely lose the hard-earned ground we have gained, if people begin discarding public health measures even as variants begin to get a foothold in the United States.